Last month, a man named Walter sat in my exam room, and before I could even say good morning, he pulled off his shoe and sock and just looked at me, waiting. His ankle was swollen to nearly twice its normal size, the skin so tight it looked shiny, and when I pressed my finger into it, the dent stayed there for almost 10 seconds before slowly filling back in. He'd been ignoring it for almost 3 weeks, telling himself it was just from standing too long in the garden. I want to tell you what I found that day. And more importantly, I want to tell you the handful of questions I ask every single patient who comes to me with swollen feet. Because those same questions might tell you something important about your own body right now, today, while you're watching this. My name is Dr. Anderson Coco, and for nearly 20 years, I've worked with seniors here in Virginia on exactly this kind of concern, the ones that seem small at first, easy to brush off, but sometimes are your body's way of quietly waving a flag at you. Swollen feet and ankles is one of the most common things I see in patients over 60, and I want to walk you through this properly today, calmly, thoroughly, without alarming you unnecessarily, but also without pretending it's always nothing, because sometimes it genuinely isn't nothing, and knowing the difference matters more than almost anything else I could teach you. Let's start with the basics, because I think understanding what's actually happening in your body helps take away some of the fear that comes with not understanding something. Medically, we call this condition edema, which simply means fluid building up in the tissues of your body, in this case, your feet, ankles, and sometimes your lower legs. Your circulatory system is constantly moving fluid around your body, and normally, your veins push blood back up toward your heart with help from your leg muscles acting almost like a pump, along with a network of one-way valves inside your veins that keep blood from flowing backward. When this system works well, fluid doesn't accumulate. When something interferes with it, whether that's weakened valves, poor circulation, or a number of other factors I'm going to walk you through, fluid can pool in the lowest parts of your body, which for most of us sitting or standing during the day means the feet and ankles. Now, here's the first thing I want you to understand, because I think it takes away some unnecessary worry right off the bat. Mild, occasional swelling, especially after a long day of standing, a long flight, or sitting for an extended car ride, is extremely common and often not a sign of anything serious. Gravity is simply pulling fluid downward throughout the day, and if you're not moving your legs enough to help pump that fluid back upward, it can pool. This kind of swelling usually improves overnight, especially if you elevate your feet, and it's often symmetrical, meaning both feet and ankles are affected roughly equally. But there's a second category of swelling, and this is where I want you to pay very close attention, because this is the kind that genuinely deserves medical evaluation, sometimes urgently. Let me walk you through what I look for, the same questions I asked Walter that morning in my office. Question 1. Is the swelling in both feet or just one? This might be the single most important question I ask, and I want you to remember it. Swelling in both feet and ankles, roughly symmetrical, is far more commonly associated with systemic causes, meaning something happening throughout your whole circulatory or organ system, like heart function, kidney function, or liver function. Swelling in just one foot or one leg, especially if it came on relatively suddenly, over a day or two rather than gradually over weeks, is a different story entirely, and it's something I take very seriously, because one of the possibilities we have to rule out immediately is a blood clot, specifically what's called deep vein thrombosis, or DVT. A blood clot in the leg can be dangerous not just because of the leg itself, but because if a piece breaks free, it can travel to the lungs and cause a pulmonary embolism, which is a genuine medical emergency. I want to be very clear here, because I don't want to cause unnecessary panic. Most one-sided leg swelling isn't a blood clot. It could be a muscle strain, a minor injury you don't even remember, a skin infection, or a number of other less serious causes. But because the stakes are high if it is a clot, Any sudden one-sided leg or ankle swelling, especially if it comes with pain, warmth, redness, or a feeling of tightness in the calf, deserves a same-day or next-day call to your doctor, not a wait-and-see approach. This is exactly the kind of symptom I never want you to sit on for weeks, the way Walter did, even though in his case, thankfully, it turned out not to be a clot. Question 2. How does the swelling behave when you press on it? This is something you can actually check yourself right now, and it's exactly what I did with Walter's ankle. Press your finger firmly into the swollen area for about 5 seconds, then release and watch what happens. If a visible dent remains in the skin for several seconds before slowly filling back in, we call this pitting edema, and it's often associated with fluid overload conditions, things like heart function issues, kidney function issues, or certain medications. If the swelling feels more firm, doesn't leave a lasting dent, we call this non-pitting edema, and it points toward a different set of possible causes, including certain thyroid conditions or lymphatic system issues, meaning problems with the network of vessels that drain excess fluid from your tissues. Question 3. And this is one people often don't think to mention to their doctor unprompted, so I always ask directly. Has your weight increased noticeably over a short period, say 3 to 5 pounds within just a few days? This can actually be a meaningful clue, because rapid weight gain over a short window, especially combined with swelling, can indicate your body is retaining fluid faster than normal, which is something we specifically watch for in patients managing heart function, because it can be an early warning sign before more obvious symptoms develop. Question 4. Are you experiencing any shortness of breath, especially when lying flat? Or do you find yourself needing an extra pillow at night to breathe comfortably? I know this question seems completely unrelated to your feet, but it's actually deeply connected. When the heart isn't pumping as efficiently as it should, fluid can back up in 2 directions, downward into the legs and feet, causing the swelling we're talking about, and upward into the lungs, causing that shortness of breath, particularly when lying flat, because gravity is no longer helping pull fluid away from the lungs the way it does when you're upright. If you've noticed both symptoms together, swelling and any new shortness of breath, this is genuinely something I want you to bring to your doctor promptly. Not because I want to frighten you, but because catching heart-related fluid retention early makes an enormous difference in how manageable it is. Now let me walk you through the range of causes I actually see most often in my own patients, because understanding the full landscape helps put your specific situation into context. The most common cause I see, by far, especially in patients over 65, is simply venous insufficiency. This means the valves in your leg veins, the ones responsible for pushing blood back up toward your heart, have weakened over the years, which is a very natural part of aging for many people, especially if you've spent decades on your feet for work, or if you have a family history of varicose veins. When these valves don't close as tightly as they should, blood can pool in the lower legs, and fluid seeps into the surrounding tissue, causing that familiar end-of-day puffiness around your ankles. This is generally not dangerous, but it can be uncomfortable, and there's a lot we can do to manage it, which I'll walk you through shortly. The second common cause is medication side effects. And this one surprises a lot of my patients because they don't realize their swelling might be connected to something their doctor prescribed. Certain blood pressure medications, particularly a class called calcium channel blockers, are well known to cause ankle swelling as a side effect in some patients. Certain anti-inflammatory medications, including some over-the-counter options many seniors take regularly for joint pain, can also contribute to fluid retention. Steroids, certain diabetes medications, and even some antidepressants can play a role as well. I always tell my patients, bring your full medication list to this conversation, because sometimes the fix isn't about your feet at all. It's about reviewing whether a medication adjustment, always in consultation with your prescribing doctor, might resolve the swelling entirely. The third cause, and this is one I take very seriously in my evaluation, is heart-related fluid retention, sometimes related to a condition called congestive heart failure, which sounds frightening, I know, but I want to explain it clearly rather than let that phrase sit there being scary and vague. Congestive heart failure doesn't mean your heart has stopped or is about to stop. It means your heart isn't pumping as efficiently as it once did, and fluid backs up as a result, often first noticeable in the feet and ankles, particularly by evening. This is exactly why those questions about weight gain and shortness of breath matter so much in my evaluation, because together with swelling, they paint a picture that helps guide what additional testing might be needed. The fourth cause involves your kidneys. Your kidneys play a central role in regulating fluid balance throughout your entire body, and when kidney function declines, which can happen gradually with age, or more specifically, with conditions like long-standing diabetes or high blood pressure, fluid can accumulate, again often first noticeable in the lower legs and feet. This is one of several reasons I recommend seniors have regular kidney function blood work as part of their annual checkup, even if they feel completely fine, because kidney function can decline quite gradually and quietly before symptoms like swelling become obvious. The fifth cause is liver-related, and while less common than the others, it's worth understanding. The liver produces a protein called albumin that helps keep fluid properly balanced within your blood vessels rather than leaking into surrounding tissue. When liver function is compromised, albumin levels can drop and fluid can shift into the tissues, contributing to swelling, sometimes alongside other signs like abdominal swelling or changes in skin color. The sixth cause, which I want to mention because it's genuinely common and often overlooked, is simply prolonged sitting or standing combined with reduced activity levels. As we get older, many of us naturally become less active throughout the day, whether from joint discomfort, general fatigue, or simply changed daily routines after retirement. Less movement means less of that natural muscle pump action in your calves that normally helps push fluid back up toward your heart. And over time, this alone can contribute to noticeable end-of-day swelling, even without any underlying medical condition at all. Now, let me walk you through what I actually recommend based on what's causing the swelling, because the right approach really does depend on understanding your specific situation first, ideally with your doctor's input, especially if this is new or worsening swelling you haven't discussed with anyone yet. For general, mild, venous-related swelling, the kind that improves overnight and affects both feet fairly evenly, here's what I recommend to my own patients. First, elevation. Several times throughout the day, and especially in the evening, elevate your feet above the level of your heart for 15 to 20 minutes. This uses gravity to help fluid drain back toward your torso rather than pooling in your feet. A simple pillow under your calves while lying on the couch works perfectly well. You don't need anything fancy. Second, compression stockings. These are specifically designed to apply graduated pressure, tighter at the ankle, gradually looser moving up the leg, which helps support that natural pumping action and prevents fluid from pooling. I generally recommend a moderate compression level for most of my patients dealing with mild venous swelling, though I always suggest getting properly fitted rather than guessing at a size, because poorly fitted compression stockings can actually be uncomfortable or even counterproductive. Third, and I know I've said this in previous videos, but it applies here too, movement matters enormously. Even simple ankle circles, flexing your foot up and down while sitting, or short walks every hour if you're someone who sits for long stretches can meaningfully activate that calf muscle pump and reduce fluid pooling throughout the day. Fourth, watch your sodium intake. Excess sodium causes your body to retain more fluid overall, and for people prone to swelling, even a single high-sodium meal, think restaurant food, canned soups, processed deli meats, can produce noticeably more puffiness the next day. This doesn't mean eliminating salt entirely. Your body does need some sodium to function, but being mindful of consistently high-sodium processed foods can make a real, visible difference for many of my patients. Fifth, and this one connects back to something I've discussed in earlier videos, staying well hydrated actually helps reduce fluid retention, which sounds counterintuitive, but when your body senses dehydration, it tends to hold on to whatever fluid it has more tightly, which can actually worsen swelling. Consistent, adequate water intake throughout the day helps your body regulate fluid balance more efficiently overall. Now, I want to spend a few minutes specifically on when swelling should prompt an actual doctor's visit, because I think this is the most valuable part of this entire video for many of you watching right now with concern. Please contact your doctor promptly, ideally the same day or within a day or two if you notice any of the following. Swelling in only one leg or foot that came on relatively suddenly. Swelling accompanied by pain, warmth, or redness in the affected area. Swelling accompanied by any new or worsening shortness of breath, particularly when lying flat. Rapid weight gain of several pounds within just a few days. Swelling accompanied by chest pain or discomfort of any kind. Swelling that doesn't improve at all with overnight elevation and rest. And swelling accompanied by skin that appears unusually shiny, stretched, or discolored, particularly if it's turning a bluish or reddish tone. I know that's a fairly long list, and I don't want it to feel overwhelming. Think of it less as a checklist to memorize and more as a general sense that swelling paired with almost any other new symptom deserves a phone call, rather than waiting to see if it resolves on its own, the way Walter did for 3 weeks. Let me tell you what happened with Walter, because I think it illustrates why I take this topic so seriously and why I wanted to make this video in the first place. When I examined him that morning, his swelling was one-sided, his right ankle significantly more swollen than his left, and when I asked about pain, he admitted, almost sheepishly, that his calf had been aching for about a week, something he'd attributed to overdoing it in the garden. Given the one-sided nature, the pain, and the duration, I sent him immediately for an ultrasound of his leg, and it confirmed what I was concerned about: a deep vein thrombosis, a blood clot in his lower leg. He was started on blood-thinning medication that same day, and thankfully, because we caught it before any piece of that clot broke free and traveled anywhere else in his body, he made a full recovery over the following weeks with no lasting complications. But I think about how differently that story could have gone if he'd waited another week or two, or if he simply hadn't come in at all because he'd convinced himself it was nothing. I share that story not to frighten you, genuinely. Most swelling is not a blood clot. Most swelling is far more benign than that. I share it because I want you to understand that when your body is asymmetrical in a symptom like this, when one side is meaningfully different from the other, that's exactly the kind of detail worth mentioning to your doctor promptly rather than waiting to see if it resolves on its own. Let me also spend a moment on something I get asked constantly, which is what specific foods or supplements might help with mild, chronic swelling once more serious causes have been ruled out by your doctor. Foods rich in potassium, like bananas, sweet potatoes, and leafy greens, can help your body balance sodium levels more effectively, since potassium and sodium work together in regulating fluid balance throughout your body. Magnesium, which I touched on briefly in an earlier discussion about nighttime leg cramps, also plays a role in healthy circulation and may support reduced fluid retention for some people. And I want to mention dandelion tea specifically because it's something that comes up often in my patients' questions. Dandelion has a long traditional history as a natural diuretic, meaning it may help your body eliminate excess fluid through increased urination. There's some preliminary research supporting this traditional use, though I want to be honest that the clinical evidence isn't as robust as some of the other topics I've covered in previous videos, so I'd consider this a gentle, low-risk option worth discussing with your doctor rather than a primary treatment strategy on its own. I also want to address something practical: footwear. Tight, restrictive shoes, particularly around the ankle, can actually worsen mild swelling by restricting natural fluid movement. I often recommend patients dealing with chronic mild swelling choose shoes with a slightly wider, more accommodating fit, especially later in the day when feet naturally swell somewhat, even in people without any underlying condition, simply due to gravity and the accumulated effect of a full day spent upright. If you're finding this video helpful, and if any part of what I've described sounds like something you or someone you love has been quietly dealing with, please take a moment to hit that subscribe button. Every single week, I bring you exactly this kind of thorough, honest guidance, grounded in real clinical experience and current medical understanding, because I genuinely believe seniors deserve clear, complete information rather than either dismissive reassurance or unnecessary panic. And I would love to hear from you in the comments. Tell me, have you noticed swelling in your feet or ankles? And did anything in this video help you understand it a little better? I read every single comment, and honestly, questions from this community often shape exactly what I choose to cover in future videos. Before I let you go today, I want to leave you with the single most important thing I hope you take from this entire video. Your body communicates with you constantly through small signals like swelling, and learning to actually listen, to notice patterns, to ask yourself these same questions I ask my own patients is one of the most powerful tools you have for protecting your own health as you age. Most swelling is manageable, often even preventable, with simple daily habits like elevation, movement, and mindful sodium intake. But some swelling is your body's way of asking for help a little more urgently, and knowing the difference, the way we've walked through together today, could genuinely make all the difference, the way it did for Walter that morning in my office. So, here's what I want you to do this week. Check your own feet and ankles honestly. Is the swelling on both sides or just one? Does it improve overnight with elevation? Are you experiencing any other symptoms alongside it? Shortness of breath, unusual fatigue, recent weight gain? And if anything you've noticed matches the warning signs I described today, please don't wait the way Walter did. Make that call to your doctor this week, not next month. If you want more of this kind of clear, honest, thorough health guidance made specifically for people navigating exactly what you're navigating right now, make sure you're subscribed, because next week we're going to talk about something equally important and equally common: why so many of you are waking up at 3 in the morning, wide awake, unable to fall back asleep, and what's actually happening in your body during those quiet, frustrating hours. Take care of yourselves, and I will see you very soon.